Hi, I'm Dr. Ciro Randazzo. I'm a neurosurgeon and partner at IGEA Brain Spine, and we serve the tri-state area, including New York and New Jersey.
Hi, I'm Dr. Adam Lipson. I'm also a neurosurgeon and partner here at IGEA Brain Spine.
So Adam, you're really a spine specialist, and what I want to ask you is, when I trained as a neurosurgeon at Thomas Jefferson in Philadelphia, we did big open surgeries, and now we oftentimes employ minimally invasive techniques. You're really a specialist in that, so I wanted you to comment on what you believe, how that benefits our patients.
Sure. So I think as all surgeons, we try to get the best outcome, the best result with the least invasive strategy to get there. And I think all surgery, we're oriented towards being as minimally invasive or as minimally disruptive to the anatomy as possible. The techniques have evolved, and now where we had large single open incisions, we can use smaller incisions, tubular retractors, splitting the muscle fibers rather than pulling the muscle off the bone to really access that bone and nerve anatomy and be able to provide a decompression. It's individualized towards the patient, but again, the fundamental goals of spine surgery is really to decompress the nerves, to stabilize an unstable segment, restore abnormal deformity anatomy, and take away their pain.
So should every patient have minimally invasive surgery? Is it for everyone?
You try to adapt these minimally invasive techniques across the board, and you want things to be as minimally invasive as possible. There's times it's individually tailored towards the patient. For people who have had revision surgery, a minimally invasive option really may not be appropriate for them. Yet at the same time, you try to adapt some of those techniques to make it as minimally disruptive to the patient's anatomy as possible. So I think it's got to be tailored to the patient, and that's where we sit down, we review all the films, we talk and individualize that strategy for that patient and family to meet those goals.
Is there an ideal patient for minimally invasive procedures?
No, I think anyone can have it. I think it's independent of size, weight. Actually, honestly, even heavier patients do better with a minimally invasive approach. The one thing I would caution is there is a lot of misnomers about what minimally invasive surgery. A lot of patients, as you know, talk to us about, I want a laser to treat my care. There's a time and a place where, say, a laser may be appropriate, but generally it's not a great tool for accomplishing the goal of decompressing the nerves and treating that unstable segment. But we try to have an educated discussion with the patient, because the internet's not always the best resource there.
And what are the benefits of minimally invasive techniques, and does it speed recovery or anything else?
Yeah, the real benefits, at least in the literature, is that you can get people home the same day. So we're doing more and more of this in an outpatient setting. The infection rate is reduced, and the amount of postoperative pain and discomfort is reduced. And I think those are great things. As you know, you also do a lot of minimally invasive approaches. And I think it's one of those things where we have to discuss with the patient what's the ideal setting for those types of techniques, and how can we introduce those into our surgery. As a spine surgeon as well, do you have any thoughts on that?
Yeah, I think that patients really do significantly, when they are candidates for minimally invasive spine, they do really well. Their immediate post-op pain is significantly reduced, so they get back to work earlier possibly. I think in the long term, the outcomes may be similar, but their early recovery is much faster with minimally invasive techniques than with the very large disruptive incisions and large surgeries we had done in the past.
Agreed. Yeah, thank you.
Thank you.